Hello, this is our second video about talking with different mental health professionals throughout our community for Mental Health Awareness Month, and trying to help parents and students just understand what mental health professionals do, what are the different resources in our community, and what it's like to get help. So today I'm very thankful that Jessica Gentry, who's the Director of Integrated Healthcare and School-Based Services for Bluebonnet Trails, is with us. I know Jessica well. She helps with the mental health centers that we have at Round Rock ISD. She is the one that helps to staff those and oversee the staffing of those. And so thank you for joining me virtually today, Jessica.
Sure.
And I would love if you could just talk about Bluebonnet Trails in general and what they do to serve our community.
Sure. So I've been with Bluebonnet Trails for almost 8 years. And, it's been a big honor to work in a lot of different counties that Bluebonnet serves. So we actually are in 8 counties as the local mental health authority. We're right around Travis, and we're in Williamson County and a lot of our eastern counties as well. So I would say that Williamson County and Guadalupe County, where Seguin is, those are our 2 biggest sites. But we have many rural counties, like including, out in LaGrange, Giddings, Elgin, and Marble Falls. And so we offer a wide range of services in all of those 8 counties. So we really focus on, even though we have, Williamson County, which is a non-rural community, there are a lot of communities that we serve that are very rural. And so we really get that opportunity to serve different communities with different needs. And so we offer many services at Bluebonnet Trails. And I know I'm going to miss some, but of course, Dr. Grasso, you can give the team, and give those who are interested, like contact information for me, as well as any website information for Bluebonnet. So we serve the mental health community, children and adults. And so with that comes a lot of different services, including case management, psychiatric support, counseling. We help individuals with housing and employment. Obviously, we do a lot of services in the schools themselves, and that includes counseling, case management. And for those families that are experiencing lots of challenges, we have more intensive services where we're really working with families around kitchen tables and helping them to determine like the best next steps and how to keep their family together and how to keep them feeling, safe and cared for. We also have our Intellectual Developmental Disabilities program, our IDD program, and we do a wide range of substance abuse services and crisis services. We have both outpatient and inpatient facilities for crisis for adults and children, as well as the IDD population based in our Williamson County and Guadalupe County locations, like both in those counties. And so, on an everyday basis, we're serving lots of individuals in our communities for lots of different reasons. And of course, we also have primary care included in our services, and that's through integrated healthcare. Well, we partner with another health clinic in our southern counties. So you have specifically on some school campuses, you walk in the door and you can get primary care, dental, behavioral health, substance services, IDD services, really anything, that we see really coming up in the community. So that's a very, very short explanation of what we do.
What it makes me think of, I was talking last night in a virtual session about comparing, like we have to start looking at mental health the same way we do physical health. And my dream is that we just call it health. And it seems like what Bluebonnet Trail does, that y'all care about the health of the individuals in our community and are able to help in a variety of different ways with overall well-being of our citizens.
Right. Oh, absolutely. So it's definitely whole person care is, even though, so in our Round Rock clinic and our Hutto clinic, we have primary care. We have our own provider, our own director of primary care services, and we'll be soon be hiring a lot more nurse practitioners and physician assistants to serve those 2 locations, as well as telemedicine via primary care. And so even when somebody is coming in, let's say for a traditional mental health appointment with their psychiatrist, the nurse is going to be working with them and gathering information in regards to their chronic conditions, physical and emotional, and making sure that we're really touching base about, how their blood pressure is and how their labs are coming back. That might be, we're sending all of those traditional primary care labs and getting them back to before we even prescribe medication at times, depending on what it is. And so, we're also training our staff to, when persons are coming in, including, our customer service representatives at the front door, they're asking them what do they have a primary care provider?
Mm-hmm.
When was the last time they saw their primary care provider?
Right. So if I'm a parent and I'm worried about my child's well-being, specifically about mental health, like I know I am not sure what's going on, but I notice a change, and I call the number for Bluebonnet Trails, what happens next?
Sure. So we use United Way of Central Texas actually as our front door appointment line. And so it does not matter what necessarily is going on in regards to concerns, whether it's an IED concern, substance abuse, behavioral health. You call this number, and we have a team through United Way that specifically works with Bluebonnet Trails answering those calls, and they're aware of all of the different services that we offer. So they do a screening assessment on the phone. They just take information from the parent about what's been going on, and then they talk a little bit about okay, so it sounds like mental health is the primary concern at this time. So what I'm going to do is I'm going to go ahead and get you scheduled for a clinical assessment and intake appointment. And so that can be done. We find out the closest location for which that person can go. And we can do that right now during COVID. We're doing a lot of that via televideo, of course, but in person. So we offer intakes typically in person as well as televideo, depending on how rural the location is. So if somebody comes in with their family and, they sit down with a licensed clinician to talk through what's been going on. It's usually about an hour and a half long appointment. And, the child is in the room if the parent wants them to be. Sometimes we separate it depending on the youth and how old they are. And then after that, we'll say, okay, so it sounds like we do have services at Bluebonnet Trails that could support the needs of your family right now. This is what they are. Are you interested in doing that? Yes, we are. And then we would go ahead and schedule them with a case manager, and we call that like their engagement appointment. And so then that person sits down, the family sits down with the case manager at another time within that week, if that's the best time for the family, and determine, okay, so let's just talk a little bit about what's going on and get a full picture of, what the family wants to work on, what the child wants to work on. And then referrals come out of that, for example, psychiatry, counseling. Um, we have intensive programs through the state called the Yes Waiver Program and wraparound facilitators where it's just an additional level of support for the family.
When it really sounds like if I'm a parent and I just know something's going on, that I call and that y'all help walk me through those steps. And
Right.
just the fact that I know I need to call for help is enough for y'all
Right.
to keep the process rolling.
Absolutely. And sometimes it comes to as a crisis. We do have our 24-hour, 7-day a week crisis hotline. And sometimes, obviously that's more immediate and urgent. And if you or your child are experiencing a crisis at home, our crisis workers will come out to the home if that's what it's requested. You can also meet us at the clinic or meet somewhere else in the community. Um, and we have like I said, we have outpatient and inpatient crisis services. And we also work with a lot of our state and local hospitals across our 8 counties. And so we're there the whole time. We're there when the child is released and supporting the family. We can go to the hospital and work with the child if it's not a Bluebonnet facility. And then when the child is ready to be released from the hospital, we talk about, okay, what are the next steps? How can we support them going back to school? How can we support them in ongoing services? But when somebody is put into a crisis, all the services that Bluebonnet Trails has are available to them: psychiatry, counseling, group counseling, case management. And so even though it's a very stressful time in the family's life, we do our very best to make sure that there's that continuity of care and that everyone feels supported and everyone knows what's going on.
Absolutely. And I hear sometimes from families too that they're, especially with mental health, like they're afraid to call to get services because, especially right now, so many people not having insurance, income. And so can you talk about how Bluebonnet Trails helps families in those situations?
Oh, sure. There's a lot of people coming to Bluebonnet Trails for lots of different reasons. Some folks have private insurance. Some folks, are Medicare or Medicaid, and some don't have any insurance at all. And so we have different funding sources that help us to support those individuals, child and adult, who do not currently have any insurance or are completely underinsured.
Mm-hmm.
And so there is state funding available and different pots of money available to support those individuals so they can focus on their care and not have to worry about the financial burden that it might cause. When an individual comes in for their intake appointment, we go through all of the paperwork, including the financial pieces. And, if for some reason the individual works, they do not have insurance, then it's going to be really clear with them before anything starts about what a service might cost and what that payment plan might look like, and any deductions or any like percentages off the overall amount in order us to make sure that it's feasible. But we would never ever not serve somebody based upon their financial situation. That would never happen.
Like y'all don't want people for them to self-select out saying, I can't pay for services. Right. They call and y'all will make it work with them.
Absolutely.
What do you think we can do as a community and stuff to help continue to reduce the stigma of mental health, with this being Mental Health Awareness Month?
I think that we do a lot of different programming and a lot of different presentations, and we really work very closely with our community partners so they get to know what we do better and we get to know what they do better, so we're able to connect in a way that makes it feel more fluid and more available to the community itself and the members in the community. We do mental health first aid trainings, and we do those to the schools. We do those to really any group that has requested, churches, senior citizen groups, really any kind of like Boys and Girls Club, anything that's requesting that, so they can just talk about mental health in a very general experience that a lot of people have, and that it's not necessarily permanent, and it can be due to stressors that are occurring in the community and to the world at large, and how really, taking care of yourself and actually noticing the symptoms is allowing you to actually, take the first step and have some control over something that you don't feel like you have control over. It can be done privately. However, it's not something to be ashamed of, and it's not something that gets better if you ignore it. So
that one is key. Yeah. I always say, just like a broken leg doesn't get better if we ignore it, a mental health situation doesn't either.
Right. There's a lot of yeah, go ahead.
No, I was going to say, I like what you're saying too about the education piece. That, mental health first aid is such a good education tool for communities. That the more we educate ourselves on mental health, the better we all are.
Absolutely. And I think, we really make sure that our presentations and our media campaigns and social media access and, anybody requesting any information about Bluebonnet Trails, we have staff who are assigned to those duties so that nothing falls through the cracks. If just one person, if there's a few people in the community in a small club or group wants to know more about Bluebonnet Trails, we'll go to them, and then we can talk to them about what we do. So we're doing that education obviously on a daily basis, one-on-one as well as in group. But we really try to make sure that our community partners know what we do and they have a real good sense of confidence and clarity, so that when they're talking about the referral to somebody coming up to them and saying, let's say in a church or, any kind of child, any kind of group, it's like, that a family member would say, I don't know what's going on. Like, everything just seems different. My child's really struggling, that they can make that referral to us and they sound confident in it, and that person trusts them and they have the information to share. And so that's really huge. I mean, we're really nothing without our community partners.
Absolutely. And it's one of those, instead of telling somebody, oh, just Google, I did this. Right. Google mental health assistance in Round Rock, gets sort of overwhelmed. But if somebody can say, hey, call this number, and they'll walk you through it, it feels much more approachable.
Absolutely.
Yeah.
Absolutely.
Well, is there anything else that I haven't asked that you want to share with parents or students about Bluebonnet Trails and your services or mental health in general?
Sure. I mean, like I just said, there are different things that happen to all of us at different points in time in our lives, whether it's a personal tragedy or it's, a large nationwide, worldwide pandemic, like we're seeing here. And then it's always really key to notice when there's changes in functioning. And when we're thinking about mental health, we're not talking about just because your child is struggling with depression, it doesn't mean that they're not going to be able to live a full and complete life. It could be temporary, it could not be, but there's always ways to manage through it. And so that child feels successful and that they feel like they know what's going on with them and they get the answers that they need, and so they don't feel alone. And when we're really looking at, when I'm working with a family, especially like in our schools, our relationship with Round Rock ISD, I want to know what's getting in the way of some individuals functioning. I want to make sure that they're sleeping okay and that they're eating okay and that they feel focused and that they feel, hopeful. And so when those things start to shift, there's lots of different reasons. It's a it's not something that necessarily is a crisis in the moment, but it is something that needs attention.
Mm-hmm.
Um, and that, like you said, like ignoring it is just going to make it worse. And talking about it openly, hey, I'm noticing that you're having a harder time waking up. I'm noticing that you don't really want to take a shower, that you don't really want to talk to friends anymore. Is there something that you want to talk to me about? Or can I get something set up so you can do that privately if that would make you feel better? So you want to meet the need when you see it in front of you and make sure that they know that you care and that it's important to them. But also to make sure that they feel like what they're experiencing is something that a lot of other people experience and that it's not a permanent existence.
Mm-hmm.
Um, you know,
Well, and I love what you said there. And I think it's a great message of Mental Health Awareness Month, too. Like when you see something, act on it. And the earlier we act on things, can we help? I mean, we're always going to have some crisis situations, but can we help decrease the number of crisis situations we have because we're being proactive?
right, exactly.
Well, thank you so much for your time today. And I know all of our parents are going to be very appreciative for this information.
No, good. Absolutely. My pleasure.